Good day, everyone. This is Jenko. Welcome to the Anatomy of a Scientific Article for Qualitative Research. This presentation is intended to supplement your group's review of the literature, but it is not meant to replace it. You will still need to read the article carefully and discuss among your group the best answers to the critique. This information was supplemented by some slides by Dr. Keir. So again, the objective is to review the principal components of a research article. Just a few basics. What is a researchable question? Just about anything. Inquiry leads to answers, and that's how we build the science of nursing. And it answers questions that identify, describe, explain, or predict a phenomena. Inquiry is always action-oriented, so it involves some kind of observation or some type of measurement of a behavior or an event. When you critically read a research article, there are 5 basic steps that are involved. You want to preliminarily scan the article. Kind of what's the article about? Is it a research article? Is it qualitative or quantitative? And just get a sense of where the authors are going with the article. Then you want to hone in on the problem and the purpose. Why did the researchers bother to do this study, and what answers are they hoping to obtain? Then you want to comprehensively read the article, highlight things that you think are relevant, and then you go back and analyze the article and try to synthesize understanding. So on the preliminary scan, you want to read the abstract and decide if this article is even in your area of interest. Do you want to learn more about this article and invest the time and energy to read it, or no, it's really not something that you're interested in? Then skim the article and look at the different section headings. Those will always be in big, bolder print, and we'll go over that in a minute. Does this article seem to address the topic of interest and seem readable, or is it written way above your level of understanding and it's really not appropriate to your needs? Then you want to identify the research problem or the PICO question, and again reflect, is this a concern or a topic of interest? Then identify the study's purpose or clinical question, and again, is this useful to you? In identifying the problem and the purpose, the problem is the so what question, the reason the problem is important and deserves attention, such as untreated hypertension leads to preventable end-stage organ damage. So again, we're going to look at the so what question in this Meaning of Breast Cancer Risk for African American Women article. Purpose is the population and the variables specifically examined. So an example of that is, does adhering to a low sodium diet or smoking cessation have a greater impact on blood pressure in an adolescent group of African American males? When you read an article comprehensively, when you come to a term that you don't understand or you're unfamiliar with, stop and look it up. That's why you have a textbook, and that's how you'll learn. Determine how the variables are defined. Then you want to look and evaluate any ethical implications in terms of protection of human subjects. This is a huge issue in research, and we will be studying more about that in Module 8. Then you might want to make some personal notes of interpretation as you read the article. Make some notes in the margin, and these will be good items that you can compare and contrast with your group. In the analysis section, you want to objectively critique the steps of the research project. Was the study sound and ethical? And do the conclusions make sense given the data provided? When you synthesize understanding, you try to make sense of the information. You determine the study's strengths and weaknesses and answer the following question. How severely do the limitations compromise the findings? You want to consider how useful this information is in your clinical practice or in clinical practice in general for expanding knowledge, changing practice, or more importantly, for generating further inquiry. And a reasonable question to ask is, do you believe this information is credible enough to cite in your own work? So if you were doing a research paper on breast cancer risk, would this article be substantial enough that you would want to cite it and discuss it in your particular article? Be an intelligent consumer. Critically read all published studies. Just because something is in the literature and published doesn't mean that the methods were sound or the design was rigorous and the information useful. So be a critical, intelligent consumer. So what I want you to do now is stop, if you haven't already done so, and get the article, The Meaning of Breast Cancer Risk for African American Women. The article is posted on PAL, and I want you to skim the article if you haven't already done so. Okay, I'm assuming that if you're at this slide, you have printed the article and skimmed it at least, because we are going to quickly go through it. Again, I'm not going to supplant your group's work, but I'm going to hopefully give you some ideas on things to look for and pay attention to when your group reads this for the assignment and for a grade. So the first thing you want to do is read the title, The Meaning of Breast Cancer Risk for African American Women. When you finish reading the article, you want to go back and see if this was a good title, if it was reflective of what the article was all about, or if it was misleading and really didn't give you a clue at all, and you would suggest a totally different title. You want to look at the authors and identify their qualifications. Now, this particular article is written by Phillips and Cohen, so you see that both of these authors are nurses at the doctoral level. You also see the FAAN designation. This is the Fellow of the American Academy of Nursing. To be a fellow in the American Academy of Nursing, one has to contribute significantly to the profession of nursing and be invited to membership as a fellow. And the members are not called members, they're called fellows. And this is the most prestigious organization in nursing. So anytime you see that designation, you know that most likely someone is very scholarly and has made significant contributions to the profession. You'll notice a little 1 by the RN's name Phillips and a little 2 by Cohen's name, and that's related to notations. So we want to look at number 1, and it says here, it gives her exact information. She's an Alpha Lambda, which is a chapter of Sigma Theta Tau, the Nursing Honor Society, and it gives her credentials, where she's worked, former manager, and etc., etc. Same thing for Cohen. It lists her Sigma Theta Tau chapter and her affiliation. If you'll notice on the left-hand side of the page, the word keywords. This is what the authors have coded to be the keywords. So if you're doing a literature search on you enter high risk and breast cancer and African American women, this article might pop up as an option. And under correspondence, there's always one author that's listed as what's called the corresponding author. And usually that's the lead author. The lead author is always the first name that's listed, and usually after, if there are a string of people, usually it's in descending order of contribution. When you do publish a paper, you have to sign an affidavit that you significantly contributed to the authorship of this paper, and we'll get into that a little bit more in our ethical discussions in weeks 7 and 8, because many senior faculty members were putting their name on someone else's research, like a graduate student or a doctoral candidate, and they really didn't contribute meaningfully to the development of that paper at all. So there is some accountability and ethics involved in the authorship of publications. Again, there's always a lag between acceptance and publication. So you see that this paper was accepted in February of 2011, but it was not published till several months later, and that is a very typical scenario. They always have articles in the pipeline. Okay, on the right-hand side, you're going to see an abstract, and this is a standard kind of presentation that you'll find on every research article that discusses the nuts and bolts of the research article. So you should be able to read the abstract and get a pretty good sense of what the article is all about. So again, you're going to find a pretty standard format in terms of purpose, design, methods, findings, conclusion, and clinical relevance. So again, your group will have to look, after you read the article, go back to the abstract and say, okay, did they include all the key elements of this article in the abstract, or were some items missing? The first section of this article, as well as any research article, is usually a background statement. Search of the literature to say, okay, that there's a clinical problem here, and from that clinical problem, we're going to investigate a piece of that problem. So the clinical problem here is multifold. In the first paragraph on page 239, it talks about African American women are more likely to die from breast cancer than other demographics. So right there we know that there's a population that is maybe at higher risk for poor outcomes. So again, you want to read the article background and identify a few key features. On page 240 at the top, it talks about women who have an increased risk, and that's defined as family history, genetic mutation, and past breast cancer history. So again, that's kind of the qualifications that they're using to define increased risk. Down in the next paragraph that talks with currently limited research, so they're talking about there's a clinical problem, but there's a lack of literature and research done about a piece of this problem. So in terms of identifying what is already known from the literature, the authors are saying there's a gap here. Few researchers have used qualitative methods to examine the meaning of being high risk. And so coming on down to the last paragraph on the left-hand side of page 240, they are stating the purpose of the study. So again, you want to look at, is the purpose clearly stated, or do I have to kind of figure it out through the fog? So well-written articles, the purpose is always clearly stated, as well as the clinical problem and what's already known or not known from the literature. So remember this point and re-identify this at the end of the article. As a reader, you want to answer for yourself, did the authors accomplish and readdress the purpose of the study? Okay, if you look on the right-hand side of page 240 at the top, you're going to see a big, bold header called Methods. And then you're going to see 3 smaller headers that all refer to methods, but they're different sections. So this would be like different levels of headings. So under Methods, the authors have sections about the sample and setting, the data collection schedule and procedures, and the data analysis. So you want to read each one of those sections very carefully. Let's quickly just go up to the top here and define a few terms. This study was guided by a hermeneutic, phenomenological, descriptive, and interpretive research methods. So right there, that's telling you that this is an interpretive study that's describing something, interpreting something, and delving into the phenomenological or lived experience of a situation. So all of those words tell you that this is a qualitative study. Again, qualitative refers to the quality of something, whether it's more descriptive than quantitative, is concerned with quantity or counting something. So they're not going to count anything in this study. There's not going to be any kind of statistics that interpret anything. The statistics in this study are all going to be descriptive and not inferential. So going down to the sample and the setting, it tells you right now your sample size is 20 high-risk African American women from ages 23 to 40. So again, they've already defined what they consider high risk. And again, getting back to the sample, for a qualitative study, 20 subjects is a very reasonable sample size, and we'll discuss why in a minute. So again, you want to study this section and find out how these subjects were recruited and the setting and all of that kind of information. Down in data collection, you see that they had to go through an institutional review board of 3 medical centers, and an institutional review board is commonly called an IRB. And then you will read that section in depth and determine or pull out more information. Now I want to highlight something in this section. They essentially taped an interview, and then with qualitative studies, the interviews are typically transcribed verbatim. So every single word that the subject expresses are written down. And part of the research is to look at all the verbatims and identify themes. What themes keep popping up or reoccurring? So going back to the 20 subject sample size, you can imagine that, that's a very labor-intensive process. you do not want a huge sample size for qualitative studies. So 20 is very reasonable, but it would not be reasonable for a quantitative study. So again, the type of study that you do greatly influences the methods of the study design. We're going to go back down to the data analysis and talk about how the data were analyzed. And again, the word data is plural, so it's always data were or data are and not data is. So again, that tells you that the interviews were audio taped and transcribed verbatim, and that the accuracy was verified by the interviewer. So that's kind of their internal review that the data are accurately transcribed. Again, you want to study this and find out more in depth about how they analyze that data. Okay, we're going to go to the findings section, and again you see that the label findings is bigger than the label of data analysis, so that's telling you that it's a new topic now. So again, you've got some descriptive statistics with this group, this population. It's telling you that their past history, their demographics in terms of age, socioeconomic group, that type of thing. So you want to identify all of that, and these are your descriptive statistics about your sample group. Now, they are telling you that once they analyzed all the data and the verbatims and looked for patterns and themes within the data, there are 5 themes that emerged. And those 5 themes are listed on the slide: the life-changing experience, the relationships, the healthcare experience, raising awareness, and strong faith. And again, you see that some of the verbatims are included. This is a typical pattern for a qualitative study, and you know that because it says one patient explained, another one described, another one noted, and that text is indented, so they are telling you verbatims what these women had to say. And again, that theme is continued throughout the entire rest of the findings. Again, going back to the nature of qualitative studies, you're not going to be counting anything. You're looking at exactly what the experiential component was, and you're going to have lots of verbatims. So let's go down to page 244 to the discussion section. Again, you see the word discussion is larger, and that tells you that you've switched now to a new section. So the researchers are telling you that, to their knowledge, this is the first type of study that addresses this issue. So they identified a gap in the literature, and their study is aimed at filling that gap and adding to the body of knowledge. Researchers should be able to judge the knowledge and insight of the investigator in the discussion section. Again, this is where the researcher makes sense of the findings. So the previous pages were just discussing what they found, and this is how the researchers are interpreting those findings. So this is an important component of this article. And again, you want to research all of that and make some notations in your analysis. So again, the discussion should tell you a summary of the results, compare and contrast results to previous studies, what the researchers found and what they did not find, as well as analyze why the results might not have been determined, and compare any findings to previous research. The next section that you will see is a large bold section called Study Limitations. Every study has some type of limitations because no study is perfect. So you want to identify what the limitations are that the researchers felt were important enough to mention. Now, part of the conclusion and the summary is this discussion of study limitations. It's also a discussion of clinical implications. So they have these findings, they've interpreted them like, so what? Who cares? So that's the question that you want to answer. What is the importance of these findings to the profession of nursing and to the provision of health care? So that's where you will find this information, and you want to dig through that and decide why the authors feel like this is clinically significant. That's the term that is used. Why the findings are clinically significant to the profession of nursing. On the last page, you will see the conclusion and the summary, and usually this is a brief restatement of the research and describing the implications of the study, and it is often the last paragraph. So again, you want to look at that and pull out salient features in that conclusion. Often authors acknowledge some person or group, and that's always put either at the very end or sometimes on the title page right at the very bottom. So an author might want to acknowledge a research librarian who's helped them with the literature review, or in this case, the authors want to acknowledge that this research was funded by the National Institute of Nursing Research and the University of Illinois Center for Reducing Risks in Vulnerable Populations. So they have essentially gotten grant money to fund their time and effort and expense in conducting this study. Grant money is becoming more and more scarce, and the competition for that is becoming more rigorous, and so it is becoming increasingly difficult for some researchers to get grant money. They have added some clinical resources here for the clinician, so that's important to note. The last thing you want to look at is the quantity and quality of references. If a study only has 2 or 3 references, they really probably didn't do an exhaustive review of the literature. So you want to look at what they've cited, and if the titles of the research articles that they've pulled and looked at and kind of evaluated make sense with their clinical problem and PICO question. You also want to look at the dates of publication. Are these reasonably current compared to the publication date? So again, this was a 2011 article, and you know they've got a reasonable amount of current articles in their study. some from 2010, 2009, 2006, but some a little older, 2000. That wouldn't be unreasonable if it was a particular type of article. Now, this Cohen article in the Bib is about, this is a research guide about the methods. This isn't a particular research article about breast cancer per se. So you want to look at some of these older references. Do they have more to do with the study design or methods than the actual study itself? So these authors have a reasonable amount of varied references, but you want to look at those for yourself and decide whether they've addressed research articles and other resources that are broad enough to reflect the population that they studied, the African American high-risk young woman, and relating to their PICO question. Okay, so I hope this brief overview has helped you with your research assignment. And again, this relates to the qualitative article, The Meaning of Breast Cancer Risk for African American Women by Phillips and Cohen, published in 2011. Thank you very much.